Hello, and thank you for viewing my poster titled La Gente Unida, Latinx Immigrant Health Advocacy and the Downstream Effects of Racism. My name is Mario Alberto V. Espinosa Kulik, and I am a PhD candidate in sociology at the University of California, Santa Barbara, and health policy research scholar with the Robert Wood Johnson Foundation. This project responds to anti-immigrant policies that promote a culture of fear and undermine the health of immigrant communities. Researchers have found that militarized policing and enforcement efforts are associated with greater stress, worse health, and healthcare avoidance among Latinx immigrants. As well, Latinx immigrant groups remain underserved by existing health services. Both acculturative stress and discrimination can impact physical health through the mediating effects of anxiety. Understanding and changing these disparities must take into account heterogeneity within Latinx communities, a diverse national origins, and indigenous identities, cultures, and languages are all a part of this broad group. In this poster, I address the research questions: what health conditions are of most concern for Latinx immigrant and indigenous communities on the Central Coast, and what tactics and strategies do advocates employ to impact health care and health policy? The La Gente Unida project answers these questions. For the study, California's Central Coast was defined as Monterey, San Luis Obispo, Santa Barbara, and Ventura counties. The larger project included a strategy of mixed methods data collection guided by a decolonial-inspired framework. You can learn more about the project at the link included on the poster at https://LAGENTE-CC.wixsosdesalud. IRB approval for the full study was received from the University of California, Santa Barbara. Data collection efforts were initially guided by participant observation of in-person and virtual events from 2018 through 2020, which involved constant reflexivity and writing of memos and reports. The larger political environment was analyzed through a sample of ethnographic news data with 148 documents and a systematic sample of 4,768 articles published on the Central Coast. Qualitative data collection also included 31 interviews with community members and advocates and regional focus groups with 12 participants representing all 4 Central Coast counties. Finally, the main focus of this poster is data drawn from a health needs and asset survey that reached 260 individuals. The questions were developed in collaboration with community members, organizational leaders, and expert survey researchers. Topics in the survey included demographics, experiences of healthcare, and perceptions of community-level health factors. 177 eligible respondents included immigrant community members defined as undocumented, dreamers, mixed status family member, resident, and/or a naturalized citizen, and advocates who were defined on the survey as individuals that actively participate in social change efforts toward advancing immigrant health equity. Most of the sample were a hybrid of both advocate and community member. The rest of the sample was split between advocates who were not community members at 22% and community members that were not advocates at 19%. The sample was predominantly Latina, OX, or Hispanic, and women. COVID questions were added during March 2020 and include a subsample of 65. Let's look closer at the downstream impacts of racism. First off, healthcare avoidance. Respondents indicated high rates of healthcare avoidance within the past 3 months. 46% of respondents avoided healthcare because appointments were not available, and 38% reported that services are too expensive. There were also clear disparities based on demographic factors. About half of the sample spoke English and Spanish. 1 in 5 Spanish-speaking respondents avoided healthcare because their documentation status prevents them from accessing health insurance, a rate significantly higher than English-speaking respondents at only 2% or 1 in 50. Differences were apparent in how respondents rated their community's access to healthcare resources. On a self-reported scale from 1 to 4, Indigenous respondents reported lower ease of access than non-Indigenous individuals when it comes to public transportation, with a mean of 2.1, hospitals with a mean of 2.2, and sexual health services with a mean of 2.2. These differences were statistically significant with greater than 95% confidence. Similarly, non-citizens reported significantly lower ease of access than citizens when it comes to outdoor spaces for recreation, with the mean being at 2.5, and hospitals with a mean of 2.6, and emergency rooms with a mean of 2.5. These disparities were also significant with more than 95% confidence. The downstream impacts of racism also include an increased burden of mental health concerns. Next, let's look at how these manifest in terms of anxiety. Survey respondents, on average, experienced clinical anxiety symptoms nearly half the days in the past 2 weeks. The General Anxiety Disorder 7-item scale includes items like worrying too much about different things. A linear regression model tested if anxiety was influenced by socio-demographic variables, mental health service access, and experiences of discrimination. This model estimated that these factors explain 33% of variance in anxiety scores among respondents and was statistically significant with a p-value of less than 0.001. Factors of access and discrimination were significantly associated with anxiety as well. Figure 1, shown in the center panel of the poster, presents the adjusted coefficient scores with 95% confidence intervals for each of the 4 significant predictors in the model. Respondents with greater knowledge about mental health issues were less likely to report anxiety symptoms in the past 2 weeks, and in the opposite direction, people with insurance reported significantly higher rates of anxiety, as did those with greater concern for mental health. Experiencing discrimination based on immigration status, race, ethnicity, gender, and/or sexuality was significantly associated with more anxiety symptoms. Of note, experiencing discrimination increased anxiety by 0.76 points on a 3-point scale. The implications of inequities on negative health has been exacerbated by the ongoing COVID-19 pandemic. This pandemic has had a disparate impact on Latinx immigrant and indigenous groups. The most common downstream experience of COVID-19 was that 46% of respondents indicated that they know someone who tested positive for COVID-19. Further, nearly 1 in 4 respondents knew someone who had passed from COVID-19. As seen in the bottom right of the center panel, both before and after the pandemic, nearly 3 in 4 respondents were avoiding healthcare because they could not get an appointment. Prior to this pandemic, 71% of respondents indicated a lack of appointments attributed to general unavailability, while during the pandemic, 43% reported a general lack of access to appointments, and 26% reported avoiding healthcare due to COVID-related closures. Despite all of these negative factors, Latinx immigrants demonstrate a high level of resiliency and advocate for systemic change. On the survey, individual resilience was measured on a scale from 1 to 4, adapted from the Mexican Immigrants Asset Scale. On average, respondents indicated an average resilience score of 3.2, which is nearly the maximum. Community assets may contribute to diminishing health inequities. For instance, knowledge of mental health can be a resource within families and community health programs to develop positive coping skills. Immigrant health advocacy was analyzed using participant observation, interviews, and focus groups. Community-based groups provide direct service to immigrant communities through translating health information into Spanish, Mixteco, and other indigenous languages. Beyond information sharing, these groups also raise funds for immigrant community members that have been blocked from disaster and pandemic relief programs. The pandemic has put a spotlight on essential work industries that are dominated by immigrants and people of color. Local activists have mobilized this frame to win support for improved working conditions and higher wages. However, essential workers remain vulnerable to being uninsured, especially as Medi-Cal expansion to undocumented elders has been delayed during the pandemic. These findings are useful for exposing the effects of inequity and are already being disseminated to inform concrete policy recommendations. Addressing this issue and all these issues requires wide buy-in from community stakeholders, and the sharing of findings begins with key informants, community participants, healthcare workers, social service providers, and cultural groups. As well, policymakers like city, county, and state elected officials received relevant findings and reports. Racism is an acknowledged public health crisis, but California stands to be a leader among states addressing the debilitating health effects of racism on Latinx individuals and communities. Expanding Medi-Cal eligibility, regardless of age or documentation status, is the highest impact of intervention. Another wide-ranging recommendation is hiring multilingual medical interpretation services, including indigenous language speakers. Finally, healthcare capacity must be developed through support for high-quality providers and community health workers. In California, the proposed California Medicine Scholars Program would do just that. Thanks everyone again for stopping by my poster. This project was supported by the Robert Wood Johnson Foundation through the Health Policy Research Scholars Fellowship Program and Dissertation Award. Funding was also provided by the Believe, Educate and Empower, Advocate, Collaborate, Nurture, Beacon Research Grant from the Office of Diversity and Inclusion at California Polytechnic State University in San Luis Obispo. Thank you to the study participants and to Elisa Gonzalez, Jodine Takahashi, and the research assistants at Cal Poly. Poster images are from the La Gente Unida fieldwork, and references for cited sources on the poster can be found at this link, https://tinyurl.com/refrences/LGU poster. That's https://tinyurl.com/references/LGU poster. If you have any more questions, you can reach me at mvespinoza@ucsb.edu. That's mvespinoza@ucsb.edu. Thank you.